All right. Well, good morning, everyone. It is 9:02 here on March 6th. Thank you guys very much for being on the call this morning. It's a wonderful Monday morning here at Health Plan Markets, and we are here to improve the lives of our community with affordable healthcare. Thank you guys for being a part of that mission, and thank you for being here in on the call today. So we do have a special guest later today as well. We'll have Jim Martin from VeriMed fill us in on all the great news and intro. If you haven't heard of VeriMed, they've been working with a few of you guys and really kicking off some great relationships there with provider groups. We'll talk more about VeriMed in just a few minutes. But as we normally start, we've got to keep one foot in the classroom and the other one in the field at all times. So this morning, I'm going to go through the training sessions that we've got set up for the week. And here we go. So the week of March 6th here, starting to get a little busier, which is great. It'll really start picking up in April. So this is training season. So again, you've got to keep your eye on the ball here. There's a lot of changes happening, carrier updates and information. So let's keep on top of that. This morning at 10 o'clock, Humana is doing a med sup training. So if you're interested in beefing up on your med sups, that's a good training there at 10 o'clock this morning. Otherwise, you can jump over to the United Healthcare training for their U card. This is their all-in-one membership card, which explains all the flex benefits and all the fun stuff that they've got that they've rolled out. This is a unique and industry-leading concept, so I highly recommend that you guys check that out. That's also today at 10 o'clock, wherever you are in the world. Jumping down later today, Devoted is doing a training for their networks. It's pretty interesting. You don't usually see something like that every day, so check that out. That's today at 3 o'clock. And United Healthcare is doing the virtual office sessions again this week as well. This is for 4 o'clock today, and they're doing another session, looks like, on Friday from 3 to 5. So virtual office sessions for United Healthcare. This is 4 o'clock today, Eastern Standard, or 3 o'clock Eastern Standard on Friday. And again, that's for any questions, concerns, or rude remarks that you have for United Healthcare. They'll be there waiting on the phone for you. There you go. Jump into tomorrow, Tuesday, March 7th. Cigna's doing a virtual office training session. That's at 9 o'clock. And they've got another one later in the week, Wednesday at 12:30. So these virtual office sessions are available for you to answer questions on anything that you might have. Also tomorrow at 9, Devoted's doing a network training again. So either today at 3 or tomorrow at 9 o'clock. Also tomorrow, Humana is working with Medicare and Medicaid clients. Now, this couldn't come at a better time. And this is probably one of the highlights of the week as far as the trainings are concerned. As many of you hopefully know by now, that the entire country is going through a Medicaid redetermination for those states that did not expand Medicaid and folks that were during COVID were locked into Medicaid. Basically, again, as a recap, those folks need to reapply because they may not qualify any longer. And so they've been waiting out for about 2 or 3 years now. And finally, the federal government saying, hey, you can go ahead and redetermine those Medicaid eligibles to see if they truly still qualify for Medicaid. And so what this means is there's going to be a lot of people out there that may lose their Medicaid, including your clients. Let me repeat that. There are many people out there that may lose Medicaid, including your clients. So what are you doing to prevent your clients from losing Medicaid, panicking, and finding an agent that's going to enroll them in a core plan, or finding an agent that's going to help them apply back for Medicaid? Okay. You got to think to yourself, what am I doing to protect my book of business on this? Okay. We're here to help you with that. We're putting together some game plans. The notification for Florida will happen later this week, but in other states, it's going to vary depending on which state that you live in or do business in. It could vary all the way out into the summertime. So just check your local markets to ensure that you know when Medicaid determination is happening, redetermination is happening. But start game planning. What's your strategy for this? Are you going to organize your book of business, which we're going to talk about today? How do I find my DSNP members? How do I, reach out to them and make sure that they know this information is coming? we're going to have a game plan for you on that, but we're going to talk a little bit about how you can do that this morning. But training for the week there, Tuesday, tomorrow, 1 o'clock, Humana, Medicare, and Medicaid clients. Really important that you guys jump on that, even if you don't offer a lot of Humana, which, they're the hot product for this year. So something fun tomorrow evening, WellCare and CareMax. CareMax is a provider group. They're at the Trio restaurant, which is in Orlando. So if you're in that area, you can jump in and have a free dinner and, get cozy with WellCare. So they're going to be talking about one of their provider groups on tomorrow at 5 o'clock. So you can check that out. It's a nice little thing there. And I think it's an appreciation for most of the agents that are doing business there. All right. Jumping over to Wednesday, the 8th, we've got Al doing his coffee and chat session. This is virtual at 9:30. So any questions, concerns that you have for Al across all spectrums, whether that be how to do a tabletop or learning how to do e-apps or what is Medicaid, whatever it is, Al's your guy. So he's going to be available for you 9:30 on Wednesday. You can call in and the Google Meet there is already set up for you. All right. It looks like Wednesday at noon, Devoted's doing another one of those network trainings, so that's available there. Thursday, Devoted's doing a coffee and chat session. And that's pretty much everything for the week. Remember, guys, we do have Medicare Shop training every morning at 8:30. There's a link to a video where you can go and review the features of Medicare Shop. And that's good to go there. And again, that's our quote and enroll tool for Medicare Advantage. So there it is. All right. We are going to have a special guest here, Jim Martin from VeriMed, and he's going to join us in just a few minutes. But before we hand the mic over to Jim, I do want to remind you guys that we have training with our doctors on our webinars here, and we're hosting trainings every week. And I know some of you have already gone through some of these trainings, and yes, it is 6 hours of training, but I will tell you that in order to get hooked up with a doctor like VeriMed, we are going to be requiring you to go through these trainings, okay? So if you want to get a jump start on working with providers, please jump into our trainings. You're going to go to joinhpm.com/webinars. And there I'm going to put it in the chat for you guys as well. And you can go out there and you'll just scroll down here. We've got the Spark platform training, the Medicare call recording training is ready to go. And then working with doctors part 1, part 2, and part 3. And as a reminder here, these trainings are geared to understand what doctors are looking for, why they should work with a broker, why they should work with you specifically, and what value you can bring to the partnership. So these are deep dive trainings. It also helps you understand how the money flows on their side. So you understand, what kind of patients are good for those practices, and which ones aren't, right? Because you can sink a ship with a really bad patient that's uncompliant and just not listening to the doctor. So you want to find good patients for those practices. And these trainings will teach you how to do that and how to create marketing campaigns and just have a great relationship with your providers. So if you haven't jumped in and done these trainings, I highly recommend it. It's Nick and myself. And we really hope that you get those done because it is required before Nick punches you in with a doctor group so you understand what's going on there. Okay. Last thing too, before I pass it to Jim, I do want to share with you a couple of updates on the Spark platform, our CRM system. Again, these trainings are happening throughout the week. So if you have not yet gotten your Spark training or your CRM system hooked up, please reach out to us. You guys know how to reach us and we'll get you hooked up. But in the CRM system, I want to show you a couple of new features that are available. The first one is by popular request. How do I download my book of business so I can do things like a mailer or a text message or an email blast or something like that? So this is an update that happened last week. You can go down from your homepage here, you're going to click Contacts on the left side, and then the purple button here on the right. there's the download button, and it'll show AEP 2022. This is your CRM. You click that and it'll download a CSV file, which is a raw data file of a spreadsheet with all of your book of business available. And it'll have all the data that you currently have in the system. This is just a demo, guys. But you could see the phone numbers, addresses, emails, and anything that you might use to contact your members. This is great for marketing campaigns specifically. So you do have access to this. This is going to become increasingly important, especially with this Medicaid redetermination that's happening. So go in there, experiment. So you guys know how to do it. Again, from the home screen, click contacts, go over to your purple button here, click the down arrow, and then you can click the download button there, AEP 2022. That was the most recent update there. So you have that available to download from your CRM system. 24 hours a day, 7 days a week, very, very easy to do. And you can manage that how you want. The second feature that I want to leave with you is collecting data and information. So I'll give you a quick example here. Let's say that you're doing a tabletop out in the community with VeriMed, and you guys got a lead, and it's somebody that says, hey, I'm interested in joining VeriMed, but they don't take my plan. How do I switch my plan and get into VeriMed? You got to first have the consent to contact, which we talked about, but let's say that they're already in the system here, okay? The next step is collecting what we call a needs assessment or needs analysis. So from the member's page, let's say it's Kelly Abbott here, and you want to send her over some information to collect, okay? So now if you scroll down the sends needs assessment, you're able to send this by email or text message now. Okay. Now, just as a quick note, it does not text message the member from your CRM. You've got to collect the link here, and it creates a link for you to pop it into your text message. Okay. So it's kind of a 1-2 punch here. So you might have to figure out how to do that, and we'll have classes on that. It's available in English and Spanish. So if you need to send the needs assessment in English or Spanish, you can do that. It'll check the email, or you can create a link here for the CRM system, and that you could drop it right into a text message. Again, the needs assessment is collecting their Medicare information, date of birth, what doctors they're seeing, what medications they're on, all of this information that you're going to use in order to help them go shopping for a Medicare plan. And in this instance, get them hooked up with VeriMed. So that way, you know, they have a home, they have the plan, and you put them on the right plan for the right reason. So again, there's trainings throughout the week. If you need help getting to these trainings, please let me know, and we can get you hooked up. So from there, I've got Mr. Jim Martin from VeriMed. Jim, can you hear us okay?
Yes, sir. Good morning.
Good morning. How are you? Thanks for joining us.
Well, you're welcome, and thank you for the invite, Justin. I was just listening in there a little bit. Now, what are we looking at, about 15 minutes here?
Yes, sir. If you could spare that, that would be fantastic.
Absolutely, absolutely. And I see 30 participants, so that's a nice, robust Monday morning team, you know. And as I was listening to you just now describe the process for kind of establishing that prospect list, you know, and qualifying those individuals and having them in, it reminds me, Monday morning is my father used to say, I came from from an insurance family, right? My dad was Metropolitan Life and Health for his entire career. And he used to always say, it's always good to have somewhere to go on Monday morning when you come into work, because in sales, you know, and just listening to you and the training that you guys, a little bit of your internal communications that I picked up on there, that's a sign of a really good organization. And so good morning to everyone. I want to say this, VeriMed IPA, I have worked for VeriMed. I'm closing in on 3 years now, and starting to learn enough to be dangerous about this Medicare Advantage value-based contracting world. And really interesting that you guys are actually, Justin's talking about offering some training on some of the nuances of what and how we do our thing, because it's very interesting what kind of service these Medicare Advantage members get from an IPA that has a good MSO service. And so I like hearing that. And if I was a salesperson in the Medicare world, in the insurance world, I would want to work for a brokerage that provided ongoing, training and continuing education. And so that's one of the reasons when I met actually Sergio,
Mhm.
when I first joined VeriMed a few years ago and was noodling around over in the Orlando area, I do network development. So I go out and recruit PCPs to join us as an affiliate and take our contracts. And I met Sergio, and then you guys, next thing I knew, y'all recruited Nick and a couple of your agents. I met Phil Coughlin. I don't know if Phil's on this call, but he's like the pro.
Probably is.
Yeah. And so I'm like, wow. And so I told Martin had asked me, I was sitting out a non-compete during my first 15 months with VeriMed. So he said, Jim, help us get connected with the broker channels, because VeriMed had typically relied on the captive channels for their enrollment. And so, man, I was like, we need to get to know these guys. And so we brought Justin and Sergio and Nick over to VeriMed. And from that point on, that was a year and a half or so back. And we have then begun to build this relationship. You guys tend to recruit not only quality management personnel, but quality salespeople. And so thank you for letting me join in here. And
Appreciate it.
I'll try not to go over my 15 minutes and maybe leave a couple of minutes for Q&A if necessary. But
Yeah.
So we're an IPA, that's Independent Practice Association. So primary care doctors join our network and they can take our contracts. We have 7 Medicare Advantage contracts, really all the good ones that you guys like. There's a couple we don't have because our management team or our owners, we like to do those 7 very well. So those 7 are Humana Gold, Care Plus, United Healthcare, not through WellMed, but on our own direct with United, Freedom Health, Optimum Health, Devoted Health, and WellCare. So those are our big 7. And VeriMed, we have 91 offices. So we're kind of like mid-sized or medium-sized in this IPA space. And of those 91, we own 20 of those offices. So we're not unlike the typical IPA business model. Most of the IPAs that are kind of significant players in this niche space where we operate, we're the middle guys between the health plan and the office. And so most of the competitors, I would say, own a portion of their offices. And then in our case, we have 71 and growing, 71 plus affiliates. So the affiliates are the ones that join us. They retain ownership in their practice and they take our 1 or more of our contracts. And so Martin, our owner, likes, and let me say this, we're still privately owned. So we're getting to be we're kind of we started out as a mom and pop a few years ago, and in a way we still operate like a mom and pop, but we're becoming a big boy company. So we've got, we're adding our 3rd marketing position, someone strictly for event coordination, because we're pretty spread out now. We've grown, we've added about 20 offices in the past couple of years. And so we're growing into our footprint, but we're still, if Sergio or one of you guys has an issue and you want to call, one of our PCPs wants to call about an issue with something going on in their office, or they can call the owners, Martin and Dr. Cho. Dr. Cho is our chief medical officer. And that's our 2 owners at VeriMed. And so we're still, Martin doesn't want to sell. And he is very hands-on with the business, but that's kind of the mom and pop thing. It's really an advantage. And I'll kind of lead into some of I want to give you guys a few, what I see as value propositions. When the doctors ask me what's different about VeriMed, these are the couple, 3 things that I talk to them about that I think are good for you guys because they lead to retention. And
Yes.
I understand what your all's objectives are. And I'm a sales guy. All my 44 years in the professional world, I've worked in medical sales. And the bottom line is we want to grow. And I was glad to hear what Justin was talking about, quality panels. And it's kind of like I say, this is a difficult business to understand. What is a quality patient for a Medicare Advantage panel? It's a compliant patient, one that'll do what the doctor tells them to do. Just because they have medical complexities doesn't make them not a good candidate for this. The thing that makes them a good candidate is if they will do what their PCP tells them to do. Go get their labs done, get their x-rays, go see the specialist when they're supposed to, come into the office for the PCP, the 3 or 4 times a year for their annual or for their quarterly checkups and so forth. Compliant patients. And so we're kind of starting to get our act together pretty good at VeriMed to where we can tee it up for these agents. We've been learning how to do this over the past couple of years by engaging the broker channels. Great thing about the brokers, and all channels are important. Some offices more or less of this than that than the other, but the brokers are truly objective in how they represent kind of what y'all were talking about there with a little bit of the stuff that Justin was going over. Looking at the needs of the member. What does the member need? And we talk about this. So when we introduce, and Nick and a couple of y'all have probably been with me, when we do these introductory meetings, we like to tee it up. We put a preferred broker, or in some cases 2, if we need a male and a female on the same office. And we let the office know, for one thing, let me back up a second. When we are talking with the office about coming on board, it took me my first year or so to learn the type of office VeriMed looks for. We're not just willy-nilly looking for any PCP. If they don't have an office manager that is willing to be engaged with us, that's not the right fit for VeriMed. Doesn't mean they're not a good office, but it means they're not willing to be engaged to the point, because on the MSO side of what we do, the service that we do month to month, all these things, because you'll hear the term MSO. We're an IPA for contracting side, and the MSO is that monthly service, the middlemen, where we're helping them with their performance metrics. And if they're not willing to have our back, because this is full risk, this is full financial big boy stuff. And so if the office, including the PCP, if they're not willing to be engaged and meet with us monthly, and Martin, from the top down, Martin always tells them when we're sizing them up and they're sizing us up to see if it's a good fit. He says, when your agents come by, he says, and he a little disrespect here to the pharma industry, but he says, don't treat them like a pharma rep. And he says, those agents can help you if you will help them. And he says, let them come on by, take care of those agents. And that's smart. And so we coach these guys up to do that. So when we sit, and let me make sure I'm not running up on time, about 5 minutes here.
You're good.
When we have these meetings, and like I said, a couple of y'all have done this, and we're still learning the process, but it's like, we like to go in with the PCP, with the office manager, and with whoever's there from HPM, and either myself or maybe the operations manager, the account executive for that county who's covering for VeriMed, who's that office's account exec, or maybe someone from marketing. It just depends. But we like for them to know that this is our preferred broker. This is how we work together. And that we would like, it's very simple. We would like to focus on quality enrollment. And there's multiple ways to do that. Once we get the introductions done, we kind of try to get out of your all's way. But the marketing department, Christina, and the Tina, the digital coordinating aspect of all this, we're really getting better at helping you all, and so that we're kind of sharing the responsibilities for getting the enrollments teed up, however that might look. And that depends a lot on the time of year, of course, whether we're leading into the fall, or whether we're right now, it's a great time. A lot of you agents are starting to look at this as a 5.5 month enrollment season. And so
Oh yeah.
we've still got some good mojo going in a lot of our offices where we've got good brokers. Actually, it kind of comes down to that. The offices
Mm-hmm.
that are doing well have good brokers that are in there. They've established that relationship. So we like to get you guys introduced. We like to exchange cell numbers. The doctor gives the broker gives the doctor cell numbers. That happens
Love it.
90% of the time. Occasionally somebody doesn't want to. It's like, okay, I get it. But most of the time, the doctors that are good at this understand why they're doing that. The office manager, cell number. How do you like to be communicated with, Mr. and Miss Office Manager? When we sign up a new member, do you want it by email? Do you want it by text or a phone call? The bigger offices have a referral coordinator. Boy, that person is a key. And we try to, whether they're in that meeting for the full, and by the way, these are not quick wham bam kind of meetings. They typically last about 40 to 50 minutes. Okay, we do it at a time of day when they're not rushed. That's the way we do it. And because we want them to know how important this is strategically. And then during the meeting, maybe that first meeting, but certainly the second meeting is where we can really start talking about the tactical planning. How do we get beneficiaries in front of the agents? This is really not rocket science, and we want to put what you were just talking about, Justin, qualified Medicare beneficiaries. Depending on the county, we have some emerging markets. We're still building out over in Orlando. We're up to 10 offices there in the 3-county area now, and good offices. By the way, our PCPs tend to be good communication skills. As far as getting out there, they're pretty good to very good, a lot of them, at their bedside manner. But we like to, we really look at this enrollment world. I mean, even during the SEP session, second and third quarter, a great time to be doing the things kind of you were talking about, man, building that prospect list. And people with special needs that might be dual eligibles. We're trying to start focusing, Justin, where are we under enrolled? I mean, we're finally getting to the point where we've got 7 of these provider ops managers, so they're like account executives. They all have about 12 to 15 offices each, and we're starting to give them some accountability. Tell us in your book of business what office is under enrolled with product A or product C, because we got a strong dual community, but we're under enrolled with Care Plus or whoever's the dual, whoever's. So that kind of thing, we're starting to try and look at and work with the agents more to help us understand those things. And so anyway, man, I've rambled on here a good bit, and wow, 9:30, man, how's that for 15 minutes?
That is absolutely perfect. So yeah, Jim, we've got some questions. So fantastic, and thank you very much for giving us the elevator pitch on VeriMed. And guys, if you want to learn more, I put in the chat. It's verimedipa.com, and that's in the chat there. You can click on their link. The first question is are you in Georgia? And I think I know the answer to that, but I'll let it come from you, Jim.
We are not. We are not. Good question. You listen to my dialect, you'd think I come from Georgia. I'm actually from Northeast Tennessee, but and I guess I'm a Tennessee Vol. But yeah, man. So we are in 17 counties presently, Central Florida, and moving into Southwest. We've got a little bit of an emerging market up in the Villages, and Mary and I say a little bit. We've got 3 offices up in those 2 counties, and looking to grow more into that footprint, especially with that United contract, right up the Villages.
Oh yeah.
Yes, and so United's opening some doors for us in some of these emerging Southwest Florida too, because of just their traditional model for this value-based contracting. But yeah, just as Central Florida, 17 counties presently.
Got it. And just in case you want to bring it to Martin, we've got an incredible team in Georgia that does a great job in the Atlanta, Savannah market too. So, there's opportunity there for sure. So we'll talk later on that.
Nice.
Yeah, so Elisa asked, will HPM be exclusive agents in VeriMed offices? And boy, would I love that to be a yes, but I know that you guys do work with other groups and you do have captive agents in certain offices. So so yeah, that's a question that they get a lot.
That's a great question. And so I speak for VeriMed on this. We will not have, think about our reputation. If we're coming in 6 months after we bring you guys in and tee it up for you and say, hey, we've got another exclusive, we a term, a preferred broker. We don't
Right.
do that unless if we've laid an egg, and it's not, when I say we, it's not just the agent. We didn't do a good job
Yeah.
of getting it teed up, or the doctor's not engaged, or whatever, and we're not generating any applications, then I will speak with the agent or with the HPM, whoever that might be, and say,
Mhm.
hey, we're going to make a change over here at Dr. Schmo because we're not building any enrollment. So, but everybody knows, because the worst thing we could do would be bring another broker in behind you guys and
Yeah.
breach that, that relationship. So when we tell them this is our preferred broker, we mean it, and we expect the office to work with that. And we can't control it because we don't own those affiliates,
Right.
but
Right.
we can have conversations. And 9 out of 10 times, it's not the office that's causing. There's something else that either we're doing or elsewhere that's not generating that enrollment volume. I will say this now, on the captive channels, the health plans are most of the time going to put a captive on every office,
Hmm.
depending on
Hmm.
the county and the plan as to what their propensity is to do that. Now, some of the plans are deferring and staffing and all of the whole metrics right now with personnel and hiring and everything seems to be affecting this. But some plans, as you guys know, Justin, more than others, are using preferred brokers as their captive.
Right.
Um,
Absolutely.
so when that happens, I'm hunky dory with that. We got to make sure that if it's a bilingual office, we're getting a
Hmm.
bilingual agent on that.
Right.
And then if it's the male female thing, we might need two bilinguals or whatever. We
Yeah.
try to fit with the office, but we cannot control whether if it's a good captive. You know what's going to
Hmm.
happen eventually? 90% of them become brokers. But if there's a good
Yeah.
captive, they're going to be in there working it because they're good.
Right.
Also, if there's a good broker that lives in the community and they want that office, they're going to be in there giving their cards. I can't control that. But
Right.
the office will understand where VeriMed's coming from. You guys, whoever we put in there, is our preferred broker.
Yep. So I appreciate that. And just to bring a little clarity for Elisa too, is once you're assigned to that specific VeriMed clinic, affiliate, or wholly owned clinic, then you are the preferred broker on paper with VeriMed and HPM. HPM will not put another agent there, and VeriMed will not put another agent there, unless, like Jim said, there's something that happened in that specific clinic. But there's another part of that, guys, is relationship always wins. And I mean that the relationship always wins. So you could have 10 brokers go into a doctor's office, but eventually one of those will come out the winner, and it's the one that has the relationship with not just the doctor, but the entire office staff, everyone from the front desk girl to the janitor in that office. You better have a good relationship with, and that's what really wins the business. So I'm speaking from experience, because those are the physicians that I really locked in step with on that. Um, and so Elisa also asks on this, is HPM and VeriMed actively marketing? Yes, we are actively marketing. We are working with Jim, and this is part of the equation, is first introducing you to VeriMed for those folks that don't know VeriMed, but also to hear Jim and to know Jim and understand where he's coming from VeriMed. And then Mark popped in a question here, Jim. What's the history of VeriMed? And I know we're short on time, but could you give us a recap of the history of VeriMed, and then what you guys are kind of doing on the marketing side now that's working?
Yes, glad to do that. So VeriMed, Martin and Dr. Cho started VeriMed IPA in 2011. So they actually go back with two predecessor companies, Prime Care, which is still operating in the Tampa area. They were the founders, along with a couple of other doctors, for Prime Care back in like 2004. And before that, Martin's first IPA was Intermed. He and Dr. Cho and Martin's father, who was a PCP, they were early pioneers with Humana Gold. When that was really the only thing that did this this particular model with the MSO, the middlemen. And so Intermed kind of sunset in 2004 and became Prime Care. And then Martin and Dr. Cho split off in 2011 and became VeriMed. And so that, we've kind of grown we add about 2 offices a year to the wholly owned group. So if you see, or you can look this on our website and so forth, VeriMed Health Group is the wholly owned. And we're rebranding, by the way, with kind of transitioning into marketing all of our website and just everything that we're doing. We have actually Martin's son, Blake, is a very bright young man. He's helping us with direct traffic on some of that rebranding, and the website needs some improvements to it. And then Christina Thumia and Nick and the young lady that's your sales manager, Alina.
Lena, yep.
Met recently. They actually came over to Tampa. They met Christina Thumia, our new marketing manager, and she has great objectivity. She's kind of coming in here with an open mind. She's got a background with Molina, but it was way out of state somewhere. So she's coming in here and she's different. And we need that because we really need to kind of reinvent the way we're doing enrollment, and some of these things that we're talking about here, we need to do it better. And so then Tina Huey she is really good with the digital marketing, and she email campaigns and all that kind of stuff, kind of taking us to a new place there. And of course, this involves the agent. We dealt with one of your all's agents recently with some exciting stuff here in Tampa. We had 40 some enrollments. Devoted Health was the only plan we had in this big office down in Apollo Beach and Brandon. They had 2 locations, but during AEP, we got 40 some applications, and your agent got most of those. Some of that, though, came from the digital side of the house, where they were just doing email blasts, and they had a good existing panel of aging in and that kind of thing that we focused on. One other thing, Justin, right quick, probably half of our offices, or maybe more than half, have another IPA in there. And so we may have 1, 2, 3 contracts possibly. Let's say on the average, we might have two plans in there. They may have 1 or 2 with XYZ IPA. And when we have that meeting with the PCP and the office manager, we're very, very, very clear. Do what's right for the member.
Right.
If that other IPA has contracts, let's say they've got Humana Gold and WellCare with the other IPA, and that's one of those is the best for the member, put the patient in there. Do what's right for the member. Everybody wins. So when we take you in, it's not just to say, okay, we've got this 1 or 2 with Devoted or whatever, and that's all we want you to show. We don't do it that way. We try to be objective about the big picture, what's best for the member. And then that office appreciates us doing that, because we've just brought them a great broker. Now they have a relationship, see, with this guy or this young lady that now they didn't have before. And so because VeriMed came in and helped them. And that's how we like to do this, like a consultant.
Yep. And that's great. And thank you for sharing that. And so to answer the question too, is if you are doing and agents, if you are doing activity and you are not working with a provider group, please let us know. Like, we want to hook you up with VeriMed so you have an assigned office. And really the true value, although Jim is saying that they do have lead campaigns and there is marketing and things like that are happening. The true value of the relationship is the retention. You want to put your patients in a good practice that you know that they're not going to get flipped. They're not going to get moved to another plan by another broker because those doctors don't know you. They have a relationship with somebody else. So you really need to build a good, strong relationship with your provider so you can put your members in and know that you're putting them in the bank and it's locked with a vault. That's really the main value prop in working with a provider group like VeriMed is they're going to protect your business, and that adds retention on both sides of the spectrum. So awesome. Jim, we got to do this again. This is fantastic. I really appreciate you being on the call this morning for our folks, and thank you for taking some extra time to answer questions. And guys, I have the websites in there. If you want to learn more, verimedipa.com or verimedhealthgroup.com. You could check out their websites. They're not too bad, Jim, honestly. They look really great.
They probably look better than the last time I went in there and noodled
Okay.
around because they've
Got
been
it.
improving them. And, my email address is the initial J Martin at VeriMed IPA. So feel free to reach out to me. And certainly Nick is like the Tom Brady of the broker business in Florida, man. I'm so glad you all picked him up, Justin, and I really meant it what I said, and that applies to the people on this call, the agents. HPM attracts quality people, and we start with that, and then we move over here to the results we're looking for, and we work our way back to the middle with how should we engineer all of this to write a lot of applications, and we've really just skimmed the surface here. So thank you for giving me a few minutes here this morning, man. I really appreciate that, and look forward to working together with you guys in 2023 here.
Oh, my pleasure.
Thanks,
my
Jim.
pleasure.
Thanks, Jim. This is Nick. Thanks for getting on here and being a part of this.
You're welcome, buddy.
That's enough.
I'm sure we'll have some calls. So
That's enough out of you, Tom Brady.
I'd rather be Dan Marino if I can.
I like that. No, that's awesome. And guys, if you didn't catch Jim's email, I put it in the chat, but you can always reach out to us at support@askhpm.com and we'll connect you to Jim and the team at VeriMed. But before we do that, make sure you go out to our webinars and get the training done, the doctor training done, because a lot of the terms that Jim used today, if you don't know them, they're in that training. Okay, so it really will help you open your eyes to what Jim's talking about and why he's moving the way he does. So Jim, thanks again for being on the call this morning. We really appreciate your time and attention. And for everyone else, guys, we'll see you here next Monday at 9 o'clock. I hope you guys have a fantastic, productive week. Thanks again. We'll talk soon. Bye-bye.